Hello and welcome to AFD TV. I'm your host Savita, here with my daddy Dr. Sam, Amber Auntie, and my co-host Michaela. Today we're going to talk about allergy shots.
Well, hi Dr. Sam, how are you today?
Great. I'm excited to get my shots so I can feel strong and not let and be outside and enjoy my life.
Wonderful. My name is Amber. I am a nurse and I work with Dr. Sam, and today we're going to go ahead and go over how we actually do the allergy shots. The great thing about the program that we have in our office is that we train our patients, the techs that are actually certified, train our patients to do these shots at the house as well. So if you feel comfortable, you feel good, you're traveling, lifestyle's busy, you can actually do these shots from your house, and that's what we're going to teach you today. First things first is Dr. Sam, of course, has already had the testing, so he's already had the antigen mixed, which are, one is airborne, one is mold. These are going to be given every other day once you're trained, and like I said in the beginning there, you're going to come in 3 times during the first week so we can first give you these injections. So basically what's going to happen is we're going to take one of these vials and we're going to clean the area. Allergy shots are given subcutaneous, which means not in the muscle, not directly in the skin, but kind of that tissue right in between. And for us, actually giving the shot in person, it's going to be done on the back of the arm. Now, also, this can be shown a little bit differently once you're giving these to yourself at your house as well. So first things first is we're going to go ahead and clean the area with alcohol. I'm going to let that dry. What I'm going to do next is I'm going to go ahead and pull up my antigen and I'm going to go ahead and give this to Dr. Sam. Make sure to clean your vial every time, guys, too. That's super important to make sure that that remains clean and you're not injecting any type of bacteria in there as well. Okay. One of the most important things when giving an injection, of course, is just making sure that the bevel is up, which is the tip of the needle. We're going to go ahead and put this in at a 45-degree angle in the back of the arm in the subcutaneous tissue. As you guys can see here, my alcohol has dried. I feel good. I'm going to get a good pinch here, and I'm going to go ahead and inject. 1, 2, 3. I do aspirate my needle just to make sure we don't have any blood return. It's really important. And then I'm going to go ahead and inject. And we're done. Generally, any subcutaneous shot that's given usually aren't bleeders, so we don't really use any type of Band-Aids on these. And Dr. Sam is good to go for another day.
And yeah, and this is really nice. Thank you. You did a great job. And the nice thing about it is I can even have my wife come and get trained.
Absolutely. Absolutely. These are extremely easy to give. You know, we do give a lot of supplies at the house just in case there were any type of reactions like an EpiPen. But again, right here, super important, and we'll go over that in our offices on how to use that as well.
And then can patients give it to themselves?
Absolutely. People can give it to themselves. I've seen all kinds of different techniques. You know, there's a couple areas that you can definitely do subcutaneous shots to yourself, and we'll teach you how to do that in the office.
Just like a diabetic would give insulin to themselves, correct?
Absolutely. And I mean, allergy testing, I mean, there's very little burn, if any, when you're giving yourself the injection.
Well, that's really convenient. It didn't hurt at all.
Wonderful.
And so how come there are 2 vials?
One is for molds, one is for airborne.
Correct. And most of mine are airborne, trees and grasses, but I do have a few mold allergies,
Right.
which will help me for some indoor allergens.
Absolutely, which is big here in the South.
Yeah. If I was just allergic to pollens, it would just be 1 vial.
Correct, but because you actually have both, just like I do, I actually have to have both as well.
Okay.
Thank you for watching AFD TV. See you next time.
Bye!
See you next time.
The medical advice provided in this video is informational and strictly the opinions of Dr. Samudrala and AFD clinics. For a personalized medical opinion, please consult your primary care physician or visit one of America's family doctors' clinics today.